Hi, everybody. We are going to finish up our digestive system lecture. This is digestive system part 3. So last time we discussed the importance of the liver as part of the digestive process and digestive system. Liver, gallbladder, as well as your pancreas was identified as the three of the accessory organs that help with chemical digestion of the food. So we described the liver. We have talked about importance of the liver in terms of production of bile. We talked about in terms of detoxification of the blood that is originating from digestive system. It gets rid of anything that could possibly cause harm to the rest of the body. And we also talked about the fact that you can store vitamins like D, A, K, and E, which are fat soluble. Now let's go ahead and talk about what is the actual bile that we keep hearing about. So when you think about your body, most of your body is made up of water, right? So most of your body is made up of water, which is about 60 to 70%. So 60 to 70% of your body is water. That means as the food is moving through your digestive system, you also going to have lots of water. Now, if you think about the fat you're consuming, if you have fat do not like to interact with the water environment of the digestive system. So instead of them being on their own, you will get these kind of fat droplets joining each other to protect themselves against the water environment of the intestines, and therefore you end up with a relatively larger structure, which is again something that I depict here, and it's also here. So when you do this, when you create a gigantic lipid structure, you actually decrease your surface area. So why do I care about lower surface area? That means that the enzyme, like your enzyme lipase, has limited access to your lipid, which basically means lower or a slow digestion for your fat. So what is my solution? My solution is, well, your body solution, I guess I should say, is that it introduces bile. So here's my lipid, here is my bile, which are these structures right here. And it's going to take that gigantic lipid or fat and break it to little structures. So instead of having a big structure, you have a small lipid droplets. Why is that important? Notice there's increased surface area. The more surface area you have, the easier lipase have access to, and the faster your digestion is. So you're literally increasing surface area, which also implies better access to the fat, and which means a faster digestion. So what we identify as bile is only and only produced by your liver. So what is the role of your gallbladder then? Gallbladder is important because it's responsible for a storage of the bile that is produced by the liver. So here's your gallbladder. So all it's doing is storing what your liver is producing. When your body needs that, it sends that bile through the duct into the duodenum, which is right here. And again, it helps with the processing of the fat. Now, if you have too much bile within your gallbladder, so too much bile or too much cholesterol, which is basically what the bile is made up of, that stored liquid inside the gallbladder can harden and form what we identify as stones. Now, what is these stones can do? They can cause blockage in this passageway and basically limit the passage of the bile from the gallbladder into the duodenum. And that can be painful. So in many cases, if somebody has gallstones and the pain persists And there is a surgery where they go in and remove the gallbladder completely. And these individuals typically live just a normal life. Sometimes, however, there might be difficulty in terms of processing really fatty food. So it might be more difficult for them to digest fatty food because, again, they don't have the extra storage of bile that would have been present in the gallbladder and would have been released if you have had the increase in fat consumption. So we have talked about all of these. I will come back again to the lactose intolerance slide later on. So looking at the blood vessels of the liver, in a typical organ, let's say your pancreas, okay? So if I was looking at my pancreas, there would be two main blood vessels. You have what we identify as pancreatic artery, and pancreatic vein. So pancreatic artery would bring oxygenated blood to your pancreas, and pancreatic vein will take away the deoxygenated blood away from the pancreas. So same concept applies to your liver. So the word that we use for liver tissue is hepatic. So hepatic artery, which is depicted right here in red, is the main blood vessel that's going to supply oxygenated blood to your liver. You have hepatic vein that is basically take the oxygenated blood away from the liver, as you can see right here, and it's dumping it into the inferior vena cava. But here is another word that you see here, detoxified blood. So remember earlier we talked about that there is a main function of the liver is detoxification. So what is implied here is when you have blood vessels coming from the digestive system with basically unchecked blood, this blood comes into your liver, which is right here through this passageway right here, through a blood vessels called hepatic portal, the key word here is portal vein. Now, as it comes into your liver, this happens to allow the blood to be what? Detoxed. Now, as the blood detox, then that blood gets picked up by your hepatic vein and then empties again into the inferior vena cava and then enter your circulation. So the main difference, if I said, what's the main difference when you're comparing all the other organs versus liver, all the other organs only will have a main artery and a main vein that basically bring oxygenated blood and take away deoxygenated blood. In case of liver, you have an additional blood vessel called hepatic portal vein, which comes from the digestive tract, bringing blood from the digestive system to be detoxed and eventually empty into the hepatic vein. Now, since we are talking about liver, let's talk about some of the medical conditions. One that you typically hear is cirrhosis of the liver. That is common in individuals who may have consumed alcohol at high levels, basically alcoholics. So because alcohol is considered a toxin, it takes a lot of effort from the liver to detox it, which causes a scar tissue to form, and the liver actually becomes fatty tissue. Now, a person who has cirrhosis of liver, as you can see, this liver does not look healthy, will require a liver transplant to be able to get the actual liver function back online. Just to kind of give you an idea in terms of the importance of the liver, in general, we say there's about 500 functions associated with the liver. So imagine it's not functional. very interestingly, if you do get a liver transplant, you never get a full-size liver because you are, even a part of liver can accomplish the same job. Now, when somebody has cirrhosis of liver or even hepatitis, you can see symptoms of that liver damage in terms of jaundice disease. This is when the bile as well as the bilirubin component, which was as a result of destroying red blood cells, your liver failed to remove the bilirubin, which is a yellowish structure in our body, and that bilirubin basically leaks back into the bloodstream and causes the white of the eye and your skin tone to have a yellowish hint to it. Again, this is common in people who have some sort of liver disease, including cirrhosis of the liver or hepatitis. Hepatitis, again, is another common thing you hear if you're working in a healthcare field. Hepatitis basically means inflammation of liver. It is caused by virus that has various strains. The most common ones that you may hear is hepatitis A, which is as a result of contaminated water or food. This is highly contagious. It is common in third world countries where they don't have proper water system. However, if somebody is traveling to the third world countries, they do recommend for them to get vaccinated against hepatitis A. If you do have hepatitis A, you need to stay away from people again because it is highly contagious. But the good thing about it is that you can take antiviral medication and recover, fully recover from it. The other type of hepatitis that you may have heard of is B and C. Both of these are spread through infected blood and blood transfusion. There is vaccination against hepatitis B. However, hepatitis C, on the other hand, there is no vaccination, and in many cases can lead to liver cancer and eventual death. So if you're looking at these types of hepatitis, the worst case scenario is hepatitis C. However, that being said, there are treatments for hepatitis, and many of these, again, are antiviral medication to slow down the activity of the virus. And I just want to take a second to look at the pictures that I have made available. So up here you have a normal liver. You can see the coloring. It looks healthy. This is a liver that is dealing with hepatitis. Again, significant difference in the structure. And then here is liver under cirrhosis. So earlier stages and then late stages. You can clearly see that the change in liver is beyond dramatic, and you really can't expect a liver that looks like this to be able to do its normal job and function. Okay, moving on to our last part of the digestive system, which is the large intestine. Large intestine is important in terms of absorption of water. So a lot of water gets absorbed as it passes through the large intestine. You also observe some ions like sodium and potassium. But more importantly, you have what we identify as a collection of good bacteria, better known as bacterial flora. And these are responsible for breaking down indigestible material and basically giving some good benefits in terms of a healthy digestive system. So if you have a healthy fecal matter, about 3/4 of that would be water and about 1/4 of it would be indigestible material. Now, that being said, what are the parts of your large intestine? So large intestine is starts with a structure right here, which is this pouch called the cecum. Couple of things about the cecum. cecum is connected to the ileum, which is the last part of the small intestine. And you're also coming off of the cecum, you have the extension of the lymphatic tissue called the appendix. The second part is the ascending colon as it moves up, then going across right underneath the stomach and liver called the transverse colon. The twisting bring the intestine downward called the descending colon. And then you have this twisting of the intestine to the posterior, basically getting closer to the rectum and anal canal. This twisting part, which is not labeled here, this is called the sigmoid colon. Sigmoid colon ends with the rectum, and the rectum into the anal canal and out through the anus. So in terms of the most common medical condition associated with the large intestine is basically colon cancer. Again, you may have heard of the colon cancer in terms of colonoscopy for elderly, or anybody, I should say elderly, anybody above the age of 50. So in a healthy colon, what you will see is a very clean tube when you look at it. And these kind of bumps that you see right here will have not been present. Now, these bumps are referred to as polyps. Now, are they definitely something that you should be concerned about? No. Depending on your genetics, you may actually be more susceptible to polyps. Now, the problem is sometimes these polyps start to grow, and as they grow, they start to have abnormal cell growth within them. So you can see this is the abnormal growth, and that abnormal growth can get bigger and bigger, and eventually get access to your bloodstream, and those cells can spread to the rest of the body. So how do we check to see if there are polyps, and if there are the polyps, if there is anything possibly dangerous about them? You do a process called what? Colonoscopy. And this is basically when a camera inserted through the anal canal, and we use the colon and again looks for these polyps. Typically, if you observe any polyps in the system, they do take a sample of that and check for any abnormality, for instance, cancerous cells within the polyp. And again, just having polyps does not mean that you have cancer. The way that if you are at a higher risk of colon cancer because a close family member of you had colon cancer is to increase your dietary intake of fiber, which helps with removal of all of the indigestible material which will not linger in your intestine, and then lowering your dietary intake of fat and proteins typically. So red meat is a possibility that may increase your colon cancer if it's not properly supplemented with fiber intake. So couple other things, disorders of the large intestines or diarrhea and constipation. Do remember that the digestive system contains a smooth muscle, and the movement of these smooth muscle help with movement of food through the GI tract or gastrointestinal tract. Now, if these movement as a result of the bacterial infection or toxins released by the infective agent is increased, so smooth muscle movement is more rapid, it doesn't allow enough time for the water to be absorbed as it passes through the intestines, making the fecal matter more watery. And if the reason as a reason of either surgery or some sort of blockage or diet, there is a decreased movement in the large intestines or intestines, then you absorb too much water, and that leads to the fecal matter becoming very dense, and that is what we identify as constipation. Typical reason for constipation also could be diets that are low in whole grain that basically it slows down the movement of the smooth muscles. Uh, Treatment, you can take laxatives, but the better way of basically dealing with this condition is increasing your dietary as well as water intake to ensure the proper movement of the intestines. And one last thing before I close this PowerPoint is going back to lactose intolerant. This is something I mentioned to you guys when we described proteins as enzyme at the beginning of the semester. However, I'm just going to mention it one more time to you. So lactose is a type of sugar that is found in the milk, and this sugar again is called lactose. And under normal condition, you will have an enzyme or digestive enzyme called lactase. So lactase is the enzyme that breaks down lactose. And in some cases, some people may have very low levels of it or non-functional enzyme lactase, which means that they basically will not have the ability to break down the sugar lactose. In these scenarios, the sugar stays in the digestive system, or lactose stays in the digestive system, which makes you susceptible to diarrhea, as the sugar holds on to the water and doesn't allow the water to be absorbed. So the extra water in your digestive system causes diarrhea. It can cause gas, bloating, and abdominal cramps as the bacteria of the digestive system get a hold of the sugar and break it down and basically produce methane gas as a byproduct. So I believe that is it. So we are finished with the digestive system part 3. We will continue with our next system, which would be our urinary system. So keep tuned.